All right, ladies and gentlemen, we are live. Welcome to Clash of the Craniums. We've got some live interactive anatomy trivia tonight. We did this just a few months ago with some rousing success. People very excited to get their hands, to get your grubby little phalanges on some anatomy trivia, and you wanted it again. So many of you reached out. We tried to improve the quality of the stream. We're working on it. We're working through it. Had this like Secret Service earpiece thing in. I don't even know what I'm doing with that. But the goal tonight is to have you walk away a little more confident, feeling a little more competent in your area of anatomy study as you prepare for, I don't know, an anatomy test in PT or PTA school, or as you get close to, the dreaded NPTE. It's not as scary as I thought. I was very afraid of the NPTE as I was getting close. The rules of the game tonight, as Julie says, let's go. Julie's excited. I like that graphic there too, Julie. Anthony's saying hi. I see Anthony and Julie have already figured out. This is not one of those classes where we want you to be quiet. We want you to get nice and loud. And since we can't have you all in the studio, feel free to get loud in the questions or comment sections in any of the social media platforms that you're watching or listening from. We will also re-release this episode online via podcast. We're going to do it through our sister podcast. Everybody knows about PT Pintcast, and some of you know about the secret podcast we launched not long ago, and that podcast is called NPTE StudyCast. NPTE StudyCast is designed super short, quick episodes that will help prepare you for that NPTE exam. So we're going to be sharing it via that channel, which you can subscribe to for free, as Rob Wilkerson says, let's go, with a lot of O's. And I like the enthusiasm. Appreciate that. All right, so let's bring in my partner in crime, the Batman to my Robin, Professor Matt Condo. Matt, welcome back to the studio.
Jimmy, how are you? How are you?
I'm doing all right. I'm pumped for this. You are our resident expert. Tell everybody about you and what you get to do professionally.
So I teach at Methodist University in Fayetteville, North Carolina, and I am the anatomy instructor along with a couple other courses, and I just welcomed in a brand new group of first-year students who are well represented on this trivia night, so I'm real proud to have them with us. And, you know, this is our second episode, and we made a ton of improvements over the first episode, and we're really excited to get this rolling.
All right. I want to know where those students are from. We're seeing how many people are logged into the stream, and that's great. Samantha is saying woo. 3 O's. That's pretty good enthusiasm. I would have liked to see a couple more O's there. Kathleen saying go Springfield College. I did a live podcast at Springfield College a few years back. Maybe eventually I'll get back up there as well. Tommy's saying there, I'm guessing he's one of your first year students. Mm-hmm. Smart if you're a student in one of Matt's classes, smart for the bonus points. I mean, just saying you're going to show up to your professor's thing. He sees your name pop up. That I'm just going to say if there's ever a jump ball, that would help is all I'm going to say.
Without a doubt. Without a doubt.
All right. So you want to walk everybody through what they can expect or what things are coming up.
So it's going to be a little bit of trivia. It's going to be a little bit of basic anatomy. And it's going to be a little bit of in between. So we have 12 questions set up for everyone tonight. The way it's going to work is going to be multiple choice. Select the answer that you think is correct. And then afterwards, we'll go through a small explanation of why that answer is the correct answer.
Yeah. Last time we did like 56 questions in 90 minutes. What we heard from you is you really wanted us to go a little bit further in depth with the whys behind the correct or incorrect answers. So we're going to make sure we dive in there as well. I got to point out this. University of Scranton represented the Electric City, home of The Office. I spent 7 years in Scranton working at a radio station. So Julie, treat the Electric City very, very well. I like to see the diversity, not just, from your home alma mater right there where you teach. I'm seeing Michigan. I'm seeing Shenandoah. I'm guessing this is another one of your students is there. Springfield College. MU represented. I'm not sure what MU is. MU, Methodist University. Got that. So without further ado, and you know how much I like ado, Matt, I say we get this thing underway. So here's how this is going to work. We're going to use the platform called Mentimeter. So on whatever device you are watching from, open another tab, or if you want to use your mobile device to play along, I like to suggest to use that mobile device. It's in your hand. It feels like a control, feels like a signaling device. At the top of the live stream, you'll see the instructions. Log on to menti.com. That is MENTI.com. And it's going to ask for a code because everything asks for a code. At least it doesn't ask if you're a robot. I always get nervous that I'm going to answer the CAPTCHA question wrong. Enter that code 7467 4614. It's an 8-digit code as we watch a bunch of you logging in there. Menti.com. Use that code 7467 4614. As we've got a bunch of you guys logging in. I'm liking to see the diversity and where people are coming in from. Go Blue, as we shout out the University of Kentucky. Last time, we're going to shout it out now. Menti.com 7467 4614 as we get ready to dive into the clash of the craniums. And we're gonna work the same way we did last time, which is the faster you answer, the more points you'll get if, of course, you answered correctly. Isn't that the way we're doing it?
I believe so.
Well, that background music can mean only one thing as we see a few more people logging in, more than 65 of you. Menti.com, use that code 7467 4614. And I think we're ready to go. So I'm going to turn it over to Matt. Matt, time to go for question number 1.
Okay.
On the screen. Let's do this thing.
So which of the following muscles is a downward rotator of the scapula? Is it the rhomboid major, lower trapezius, or upper trapezius?
All right. Think. I see a lot of you doing what I did in school, which is start touching the muscle. Which of these muscles, downward rotator of the scapula? Rhomboid major, lower trap, upper trap. Lock in your answer choices now.
Ooh. So here we go. Let's look at the right answer. The right answer is going to be rhomboid major. So let's think about it. So upper trapezius and lower trapezius work in a force couple, and they both upwardly rotate the scapula. Rhomboid major, because of its attachment on the medial or vertebral border of the scapula and its oblique fiber orientation, if you take that muscle and contract it from its insertion to its origin, it's actually going to downwardly rotate the scapula just a little bit. So the correct answer there is going to be the rhomboid major is a downward rotator. Lower trapezius is an upward rotator.
All right, so lock that in. I always used to start feeling really bad when I got questions wrong on practice tests, but look at it this way. You got it wrong in a safe environment. You're not going to get this one wrong again. So 28 of you thought lower trapezius. Now you know it's rhomboid major. You're not going to make that mistake again.
Exactly, right? It's a great safe environment. It's a great analogy.
All right. Let's move to question number 2.
Which of the following muscles is known as a lat's little helper?
All right, which of the following muscles is known as the lat's little helper? Is it the teres minor, the teres major, or is it the subscapularis? Lat's little helper, like Santa's little helper. That's what I think of. Lock in those answer choices. We're seeing 55 of you jump in for teres major. What do we think about that, Matt?
I think they're exactly right? So teres major and lats have the same exact actions. And when we think about it, latissimus dorsi is a much bigger muscle than the teres major. But since they have both of the same action profile, the lat's little helper is going to be the teres major. So very good.
Perfect. All right. So I'm guessing everybody's going to feel a little bit better. I'm seeing some chatter in the chat saying, okay, I feel better about that one because it was pretty much dead even for that first question, correct and incorrect answers. That's question.
That's okay. That is okay, right? We're here
Safe
to learn.
Space, everybody. Safe space.
Right.
Let's move along. Question number 3. All right. A patient suffers from a laceration of the quadrangular space in the posterior shoulder, which of the following arteries would be compromised? A blood supply question. Quadrangular space, posterior shoulder. Are we going circumflex scapular, axillary, or posterior circumflex humeral artery? Time's up. What do we think about those responses?
I think those responses show me that our students, for the majority, have been studying their blood supply and their anatomic spaces very, very well. So when you think about it, the circumflex scapular artery is going to be the blood supply that's located, or the structure that's located in the triangular space, right? Axillary artery is not located in any of those spaces, being the triangular space, the quadrangular space, or the triceps interval. And the posterior circumflex humeral artery is located in the quadrangular space. And the way I remember it is that the triangular space has 3 sides. Its content has 3 words: circumflex scapular artery. The quadrangular space has 4 sides. It has 1 more structure than the triangular space, being the axillary artery, and its blood supply, posterior circumflex humeral artery, has 1 more word. So 1 more side, 1 more item, 1 more word.
I like those little nuggets that you're going to be remembering and mumbling to yourself while you're taking an anatomy test or the NPTE. Those are the types of things that get me through the day.
Me too.
Yeah. All right, let's move on to our next question with Clash of the Craniums.
What does the word glenoid mean in Latin?
Ooh, glenoid in Latin. I took Latin. I don't know if I know this.
You can't get through one of my trivia nights without some Latin, Jimmy. You know that.
All right. What are the options for people to choose from?
So shoulder, socket, or arm. The word glenoid means socket. That's all it means.
That's all you need to know.
Right. So my glenohumeral joint literally is where my arm goes into the socket.
I'll be honest. When I took anatomy, I took it with actually a nun. I took A&P 1 with a nun, and she did mention that, listen, a lot of these anatomy things, they're in Latin and they're simple. And I said, well, give me an example. And she said, well, foramen magnum. I said, okay, what's that mean? And she's like, it means big hole. Yep. So on the test, look for the big hole. And that's when I sort of felt stupid, but I learned from there.
Well, and that's exactly what I tell my students. You have to remember the original anatomists simply named everything based on their language, right? They named everything without YouTube, without Google, right? Without even running water or electricity or lights. So they literally just named everything based on what it looked like, where it was, or what it did.
Okay. All right, let's progress the screen. Let's see if we can do that. So, Matt, I'm not sure what you're seeing on Mentimeter. On my screen, I'm not seeing the Mentimeter screen right now.
Ooh, yeah, so it's just popping up. So we got a little bit of a lag happening. So which portion of the glenohumeral capsule is stretched during external rotation? Anterior, posterior, or inferior?
All right. Which portion of the glenohumeral capsule stretched during external rotation? Anterior, posterior, inferior. Lock in your answer choices.
Jimmy, you're going to be super duper proud of this group. Look at those results.
Wow.
Could not slip that one past them.
That is probably the one question we've had the most correct answers on. I like that. They knew that.
I'm proud of these guys, right? So they're studying their arthrokinematics. They know their convex, concave rules and roll and slide, and it's fantastic to see.
Perfect. All right, walk us through this one. Maybe just give us a little bit of a picture to wrap their head around it to solidify it.
Sure, absolutely. So external rotation is going to be a motion where the glenohumeral joint, okay, so the convex surface, aka the head of the humerus, is going to roll posteriorly, because with convex surfaces, the roll is going to be the same direction as the bone movement, right? So my humerus is moving backwards or posteriorly. My humeral head is going to roll posteriorly. But when a convex surface is moving, the slide will be in the opposite direction, as we know. So if I'm performing external rotation, I'm going to have a posterior roll of the humerus and an anterior slide. So the glenohumeral capsule portion that'll get stretched is going to be the anterior portion, simply because the head of the humerus is sliding anteriorly into that capsule.
Perfect. I like that. Well done. 65 of you getting that one correct. Let's move on to the next question here on Clash of the Craniums. All right, give it a read. It's not up yet on my screen, man, so you got to take that away.
Patient suffers an injury to the axillary nerve. Which of the following motions will be most likely affected? Your answer choices are abduction, abduction, internal rotation, or flexion.
All right, lock in those answer choices. What do you think? See if you can visualize it.
Jimmy, you're going to be proud of him again.
Wow.
So 55 got abduction correct.
Wow,
right? So,
well done.
So think about what the axillary nerve innervates, right? The axillary nerve is going to innervate my deltoid. That's going to be the big one. And it's also going to innervate teres minor. So of the given choices, abduction will be the only motion that the axillary nerve would actually create, or the muscle that it would innervate, right? So internal rotation is going to be mostly my subscapularis, along with a little bit of pec major. That is not, neither one of those muscles are innervated by the axillary nerve. And flexion is going to be things like my anterior delt, coracobrachialis, and biceps brachii. And my anterior delt's not going to be nearly forceful enough to really have an effect there. So flexion's out as well. So abduction is going to be our answer.
Sounds good. Abduction. Honestly, we got to go back to the Latin here. Who was naming two things like push and pull and adduction and abduction so closely? I would like to throw a flag on that because it was very confusing going through PT school with ad and abduction so close.
And I agree. And that's exactly why when I teach my class, I say abduction and a deduction, because I don't want anybody to get confused, especially, I'm teaching class with a mask on at this point. They can't see my lips.
Yeah. All right. So make sure you subscribe to the YouTube channel. We're going to be doing this throughout the season. The goal is to do one of these events per month, changing up maybe the different areas. Maybe we'll do some different body systems. So a great review, but you'll never miss an episode if you subscribe to the channel on YouTube. Let's move to the next question.
What does the word fossa mean in Latin? Here's another Latin question for you. Does it mean flat? Does it mean bump? Or does it mean ditch?
Fossa. What does fossa mean in Latin? Lock in your answer choices.
Wow, look at that. 54. Got it correct. So fossa in Latin literally means ditch. And if we think about it, think about a word that we're very commonly associated with. Fossa is fossil, right? So a fossa is just a big impression into a rock of an animal or a shell or something like that, right? So yeah, fossa means ditch.
Easy to remember once you figure out that Latin stuff. See, paying attention in school, kids. It actually helps you when you're an adult. All right, fossa, looking like that ditch. All right, let's move on. Next question here on Clash of the Craniums. And what do we got?
A patient suffers from an occlusion of the subscapular artery. Which artery will provide blood to the inferior angle of the scapula?
Question number 8.
Another blood supply question. Is it the dorsal scapular artery? Is it the thoracodorsal artery? Or is it the axillary artery?
All right, think about where you are, about your area. Which artery provide blood to the inferior angle of that scapula? Lock in your answer choices.
Yep, and that's fantastic. That's going to be the dorsal scapular artery. Now, the thoracodorsal artery is a branch off of the subscapular artery. So an occlusion to the subscapular artery is also going to provide an occlusion to the thoracodorsal artery. Because if we think about it, if there's no blood getting through the subscapular, then there's going to be no blood getting through the thoracodorsal. But at the inferior angle of the scapula, the dorsal scapular artery and the thoracodorsal artery anastomose, right? They come together. So the dorsal scapular artery is still able to provide blood to that particular section.
And they're doing well. This has got to be worth some sort of bonus points for your students, right? Since they're showing up and they're doing really well. I don't know. I'm trying to help you here, kids.
I can only speak for my students. I can't speak for the students, say from the University of Michigan. I don't know what their anatomy professor wants to do with them.
I'll write you a note. Subscribe to the YouTube channel. Give us a nice review. I'll write you a note. Don't worry about it.
There we go. There we go.
Question number 9. All right, what do we got?
Which one of the following muscles is responsible for the first 15 degrees of shoulder abduction? Is it the deltoid? Is it the supraspinatus? Or is it the infraspinatus?
All right, lock in those answer choices. What do you think? We've got a secret announcement, too, coming up at the end of trivia. I want to make sure people know about a secret resource. First is NPTE StudyCast, but that's not a secret because we mentioned that as we check out the results here. What do we got?
So 60 respondents were correct. The supraspinatus is going to be the muscle responsible for the first 15 degrees of shoulder abduction. So deltoid is going to be responsible for shoulder abduction, but after the first 15 degrees. And that's simply because of the vector and the moment arm at each of those muscles. So supraspinatus is just in a little better position based on its attachment into the superior facet of the greater tubercle of the humerus to provide the first 15 degrees of shoulder abduction.
Perfect. I'm liking to see. I feel like we were off at a rocky start with question number 1, but they have rebounded and rebounded well.
Question number 1 was tough.
All right, let's move on next. What do we got here on Clash of the Craniums?
Which of the following nerves, if not functioning, would cause the medial border of the scapula to protrude from the thorax during a push-up? Is it the long thoracic nerve? Is it the axillary nerve? Or is it the accessory nerve?
This one smells like an NPTE question. Like it's dripping of NPTE possibilities.
This is a big-time NPTE question.
All right, let's see how we're looking.
We're looking good. So 60 responded that the long thoracic nerve is going to be the nerve that's implicated here, and that is correct. So remember, the long thoracic nerve is going to be the nerve that is responsible for the serratus anterior. If the serratus anterior is not functioning, we're going to see medial winging. If the accessory nerve is not functioning, that innervates our trapezius muscle, and that will actually present as lateral winging. So what I always say is long thoracic nerve, serratus anterior, medial winging, accessory nerve, trapezius, lateral winging.
Perfect. Lock those in. That feels like a very, very easy NPT or anatomy test question. Let's move on to the next one here in Clash of the Craniums. What do we got?
A patient is unable to abduct, laterally rotate, and flex the shoulder. Which injury is the most likely cause of these deficits? Injury to the C5, C6 spinal nerve, injury to the C8, T1 spinal nerves, or injury to the C7 spinal nerve?
Nerves, muscles, bones, blood supply. These are the things you got to pay attention. Put them in context if you're making up questions for yourself. And how do you think our students are going to do? What do we have on the board coming up?
59 got it correct. That is fantastic. So think about it. So where does C5 and C6 go? It forms nerves like my axillary nerve. It forms nerves like my suprascapular nerve. It actually forms 2/3 of my musculocutaneous nerve. So an injury to the C5 or C6 spinal nerves would affect all of those motions: abduction, lateral or external rotation, and flexion.
Perfect. All right. How many questions we have left here tonight?
We have one left.
Final question.
Final question.
On
This is
Clash
for
of Craniums. Let's do it.
all the marbles.
All right. What do we got?
A patient displays tenderness lateral to the acromion and has pain when performing abduction. Which of the following muscles is most likely involved? Subscapularis, supraspinatus, or teres minor?
All right. Last question of the night. Don't mess this up. Lock in those answer choices. Good quick review here on Clash of the Craniums. Want to thank Matt and all your students, plus all the students from all around the country jumping in here.
Absolutely.
What do we got on the screen here? What do we say?
So 54 got it correct that the supraspinatus is going to be the muscle implicated there. So if I have tenderness lateral to the acromion and pain performing abduction, of the given choices, supraspinatus is going to be the correct choice because supraspinatus lies in the suprascapular fossa. I can palpate it just lateral to the acromion. I can palpate the tendon. And of the given choices, that is the only muscle that performs abduction.
Perfect. All right. Are we able to tabulate and see who the winner is? And we'll tell you the winner tonight. I will volunteer to record your voicemail greeting. I'll say anything you want. It's almost like Cameo. I'll do that for you. This is priceless. I'm not selling this anywhere. You cannot buy it. Winner tonight, your very own voicemail voiced by us.
So it looks like Kaylee R is our winner.
Kaylee R. Kaylee, if you're still on the live stream, I'd love for you to drop in the chat where you're going to PT school. Let us know what year. And drop us an email address. Let me know what you'd like me to record for you in your voicemail greeting. I'll punch it up a little bit with some sound effects. Make sure to subscribe to the YouTube channel to get this and other great study content as we continue to do this throughout the year. The goal is to get one of these nights per month. Let us know which content areas you'd like us to focus on as well. We've got that resource as well as NPTE StudyCast, that free podcast as well. And Matt, you and I had talked about this very briefly. Here's that secret resource. We're going to be flipping some of the questions from this and some that don't make it onto the show onto an Amazon Alexa skill. So all you've got to do, you can take your anatomy and NPTE studying with you. If you just say, hey, Alexa, open physical therapy quiz, and she will then, as you walk around the house and clean your room, she will provide you with anatomy and physical therapy content. So try that other resource as we try to create really cool things for you to study with.
Yeah, absolutely. And, I think the takeaway message is no excuses, right? At this point, studying is more accessible than it ever has been.
I love that. All right, Matt, I appreciate the effort. Thanks so much for doing this. Congratulations to our winners and the rest of you guys for doing great. We'll see you guys again next month. Don't be a stranger. Let us know what resources we can create for you to help you on your PT journey.
Thank you, Jimmy.